Today, I'd like to introduce Dr. Barbara Sargent, who is Associate Professor of Clinical Physical Therapy here in the Division of Biokinesiology and Physical Therapy. Barbara has been on our faculty for 12 years and is the Director of the Development of Infant Motor Performance Laboratory. Dr. Sargent's research investigates motor learning and motor control to inform the early identification and intervention of infants with and at increased risk of cerebral palsy. Today, this presentation focuses on her work investigating selective motor control as an early biomarker of cerebral palsy. And Barbara, turn it over to you.
Okay. So I was given 3 minutes, so this is going to be very short. I was going to talk about a clinical assessment of selective motor control that will be published EPUB ahead of print actually next week. So as most of you know, I have been investigating selective motor control as an early biomarker of spastic cerebral palsy using sensors for the last 10 years or so. But in order to really implement this into clinical practice, we needed to develop a clinical tool. So the current clinical tool that's used, it's called the General Movement Assessment. It's very nice. You just video a child between the ages of 3 to 5 months of age for 2 minutes, and then a trained scorer goes in and views that video. The absence of fidgety movements at 3 to 5 months is highly predictive for cerebral palsy. Some of the limitations of this method are it requires 3 days of in-person training and ongoing practice. It requires storage of videos at sites, which is sometimes a problem. It cannot be used outside of the 3 to 5 month age range. So if you have a 6-year-old, a 6-month-old, or an 8-month-old, it's no longer valid, and it doesn't predict future function. So along with Eileen Fowler and Loretta Stout from UCLA, we developed the selective control assessment of the lower extremity for infants and toddlers. We're calling it mini scale. Eileen Fowler and Loretta Stout already developed SCALE, the selective control assessment of the lower extremity for children that is 4 years of age and up. So mini scale kind of took that scale and aged it down so that we could do it for children as young as 3 months of age. What the scale is we look at one isolated motion at each joint. And so these are the motions. The child is scored a 0 if they do move that joint through that range completely in a synergistic movement. A 1 if they're synergistic, if they have partial selective motor control, and 2 if they have full selective motor control with that movement. And so what we did is we took 50 children that were typically developing at risk for cerebral palsy or with cerebral palsy. And we gave them both mini scale, which you see along the y-axis, from 0 being their completely in-coupled movement, so fully in synergy, to 20 where the children are completely out of synergy and they have full selective motor control. And then along the x-axis, you can see this is a gross motor assessment. And so normal development is between kind of 1 and 1.5, with more atypical development being that lower range from 0 to 1. So you can see here the blue are the typically developing children. So they all are getting basically full credit on the scale, and they all are falling in that normal development range. And then we have the children with cerebral palsy who have a nice alignment between their mini scale score and their development, showing that the selective motor control or the mini scale is associated with gross motor function, which we know it is actually with older children and adults with cerebral palsy. So in conclusion, this is the mini scale and this is the score sheet. This is a clinical assessment that can be used from 3 months to 4 years of age. It is associated with motor function, and we do have some evidence to support that it has potential to predict future function, but I didn't really have enough time to do that today. So thank you.